Hi, I am Dr. Vu Isabel. Periodontal disease is not merely an oral condition, it is a chronic inflammatory disease that can affect the entire body. Because its early symptoms are often subtle, it is easy to overlook. However, ongoing inflammation in the gums allows bacteria and toxins from dental plaque to enter the bloodstream, triggering systemic inflammation and significantly increasing the risk of various health conditions. Scientific evidence has shown strong links between periodontal disease and the following diseases. Cardiovascular disease increases the risk of atherosclerosis and heart attacks. Diabetes has a bidirectional relationship with periodontal disease, making blood sugar control more difficult. Respiratory infections. Oral bacteria that are inhaled can lead to pneumonia and other respiratory illnesses. Pregnancy complications raises the risk of preterm birth and low birth weight. Alzheimer's disease. Periodontal bacteria can enter the brain, increasing the risk of neurodegeneration and potentially accelerating disease progression. Rheumatoid arthritis. Periodontal disease and rheumatoid arthritis share a common basis of chronic inflammation, which drives autoimmune responses. Improving periodontal health can also help reduce the activity and severity of rheumatoid arthritis. Prevention and management. Multiple international dental associations unanimously recommend that, in addition to maintaining daily oral hygiene, scheduling a professional dental cleaning and checkup every 6 months to thoroughly remove dental calculus and plaque is a key investment in preventing chronic gum inflammation and safeguarding overall health. Actively managing periodontal health is, without doubt, an important line of defense for the entire body.